Welcome everybody to Advocacy in Action, and super excited to have our guests here today. And we'll get right to it in just a minute. If you all could drop in the chat just who you are and what brings you here today. That way, our guests will have an idea of who's in the audience, so can also kind of in their minds know what information to share. And hold on one second. There we go. So, just so everybody knows, this is Advocacy in Action, and I am the director of the Regional Autism Advisory Council, which lives at the University of Cincinnati in the IDD Education Center. And we've started this meeting, Amanda Tipkemper and I, who is a consultant and longtime educator in the field, and she and I came together about a year ago and talked about just offering a time to share resources. We hear from the community that there are so many resources and it's hard to navigate what's good for one thing, what's good for somebody, what's the right fit, all of the different things. So this is a space to offer different resources and share these topics with you so that you can be more informed to help the student or the child or the young adult that you are serving. So this month's topic is navigating behavioral health resources. And this is a part one of part one of two series. And at the end of June, we are going to have a few other organizations sharing what they do and how to navigate their resources and what they do for the community. So without further ado, I am going to turn it over to Courtney and Steve. And who wants to go first? We didn't talk about that.
Whoever wants, I'm open. Courtney, I'll get out ladies first. How's that?
Okay.
Sounds great.
Appreciate it. So thanks for the introduction. Let me get my screen shared here. I'm going to share it in Google Slides format instead of presentation format. It's just easier for me that way. Hi, my name's Courtney Slocum. I'm the executive director of our community programs at Transitions Behavioral Health. I'm also a board certified behavior analyst, and I would consider myself a disability self advocate. I'm a disabled veteran and neurodivergent myself. So thanks everyone for showing up today. And that disability self-advocate kind of drives forward the leadership and approach that I have with my team at Transitions Behavioral Health. So Transitions, we are in the Southwest Ohio area. Our community services are in Butler County, Warren County, Montgomery County, Hamilton, Claremont, and we have at least one referral in Brown County. Really our driving mission is to close gaps in access to quality and appropriate mental health services for individuals with IDD. So we do these through these items that are listed here on the slide. So again, our mission is to improve access to quality mental health services for individuals with intellectual and developmental disabilities. So we have services are provided across the lifespan. So I think one of our youngest clients is, 18 months, and then our oldest client is in his 70s. So we're all across the lifespan. One of the centerpieces of our service is the family engagement. We are really meeting families where they are. And the meat and potatoes of our program is in our service and our agency is our skill building. Every single part of our services is centered on skill building and use of evidence-based tools. We also use measurement-based care and do tons of cross-system collaboration. So again, services across the lifespan. So we do this through the following ways. with the following services and programs. So we have our early intervention programs, which are in the Claremont County area in Anderson and in Hamilton County. Those are building facility-based services. And I should say out the gates that this is all funded through Ohio Medicaid, and then the waiver for adult day programs. We do not currently accept any other funding sources for our services. So we also have our community and school-based services. And a big element of those services is our diverse language program. So those community and school-based services are provided in a few different languages with the capacity to provide additional diverse language services as needed. We also have adult behavioral health services, mental health services for individuals with IDD, and our adult day program, which is at one location in Hamilton County. So our service philosophy is we will do the work with them, not for them. So it's all about empowerment. Don't give your power away. We want to skill people up so that when we are not currently there, that the families feel empowered and confident in strategies to reduce family stress, to increase their knowledge and understanding, to increase community life, all of those different things depending on the family and the individual's needs. So with that, participation in our program with the caregivers is required and measured. That is one of the measurement-based care tools that we use to basically determine and communicate levels of care. So it's really our goal to make sustainable progress and to build a sustainable program and mental health supports. So we have our treatment framework that is that applies to our entire company, but our community-based services really use this framework. So we start with our screening process, assessment process, skill building, generalization, and then maintenance. As needed, this is obviously not linear. As needed, there might be forks in the road. There might be we need to make a U-turn and go back to assessment. It really just depends on life, what happens in life, and changes that are tossed our way. So that might look like a transition from pediatric to adult care. That might look like going from early intervention services into elementary school. So we're always open to pivoting. But this tool, this framework tool that we have, this is to communicate to everyone that is a part of our service what our services look like, to give them an understanding of what to expect, to give a clear shared vision of what expectations look like from everyone at the table. Sometimes just to really just give a time frame, like when can I really expect to see some changes? And also to really signal when we're going to kind of pass the baton over to the caregivers and families to really start to implement some strategies. So again, we can get to that. We do the work with you, not for you. So it's long-term sustainable change. This also is important when it comes to utilization. Which I'll talk about later, but there's some of the myths that I've heard through the mental health advocacy work that I've done is that when IDD is at the table with mental health, that there's a misconception or a myth that will lead to overutilization and or mask the needs of all the other population. And I really want to debunk that myth and say that there's ways that we can drive this forward without that happening. So some of our measurement and how we do that is through quality data and outcomes. So our data has really been driven by our partnerships with Pediatric Improvement Network for Quality Care with Cincinnati Children's Hospital. We also do some work with the the Health Collaborative of Ohio, through behavioral health attribution. So we have some standard tools that really just help us to guide treatment planning and outcomes and medical necessity. Because that is one of the questions that comes back around when you're providing services to someone who has IDD. Medical necessity is always going to exist, but how do you keep that relevant and maintain that golden thread and maintain progress so you're not always chasing the crisis of the week? How do you show up and provide services without misutilizing or overutilizing a mental health service? Those kind of things we are doing. We are doing that work, and I think that's why we were asked to show up here and talk today. Is just kind of shifting that and debunking that. So a couple weeks I had the privilege of sitting down with some senators up at the state capitol in Columbus for their Advocacy Day. And we weren't there to ask for more funding. We were there to talk about how we have started to and how we have really built some sustainable processes that could lead to more intentional use of the current strategies that are in place and maybe inform additional strategies that could be put into place. So that was a really eye-opening day. It was really motivating. It was also just a chance to amplify the voices of those that we serve here in Southwest Ohio, specifically the IDD population. One of the biggest missions moving forward would really be just the workforce expansion. And through Transitions Behavioral Health, we've already kind of started to do this through what I would call some non-traditional pathways. So the end all be all should not just be social workers when it comes to mental health work and providing those services. There are other pathways that can meet those specialized needs so that we could expand the workforce. So we're not just looking for tons of social workers. So we've stood up family peer support with our IDD clients. We have our qualified behavioral health specialists. We have stood up Ohio Rise Respite. We have really started to link with social workers and kind of help them because that it's not always the direct career path when I graduate, with my social work, bachelor's in social work. There's not a lot of folks that want to dig into IDD work. They, lots of times it's, I want to go into counseling. I want to go into, veterans work or substance abuse. So we've really tried to build up the workforce and motivate people to grow into IDD mental health services. And we look to create even more non-traditional pathways. But that's through advocacy and policy work on the back end, and also just persistence and not giving up and just keep showing up. So what access looks like in order to move us forward together, again, I shared that our services are based on Ohio Medicaid and then the waiver for the Adult Day program. Future priorities, again, we want to continue to expand behavioral health access. We are aware that in Hamilton County, it's a very saturated market of behavioral health services. We look to really expand access into other areas such as Butler County, Claremont County, Brown County. I've had people approach us about Adams County and other counties. So we look to replicate what has worked for us into those other areas so that we can spread the wealth per se. We also look to really strengthen the system coordination. We recognize that we've heard this thing that systems are broken, and we don't think that's the case. We just think that there's so many cooks in the kitchen. If they could just learn how to work together in a more systematic way, we don't have to get rid of cooks in the kitchen. We just, you're the sous chef, you're doing the sides, you're doing the fish, like that sort of things. And just really advancing measurement-based care. a lot of the work we've done to drive forward electronic health record systems and replicating those. Um, so I know I've spoken really fast. I wanted to give a broad brush, but I'm really not good at that. So I'm really good about digging in. But if there's any questions that you have about any of the items that I spoke about today, we can talk offline. But I do imagine there will be an opportunity for discussion after Steve shares his presentation. So thank you.
Yeah, perfect. We'll let Steve go next, but if you are like me and will forget what you're thinking about in 2 seconds, if you want to drop questions in the chat for Courtney, and then we can open it up for discussion after Steve shares his information too. Thank you, Courtney.
Awesome. Thank you there. I'll share my screen because I just have a couple little things to show from our website and I'll get started there. Okay. So my name is Steve Mentrick and I am the Multi-System Youth Regional Coach Manager with OCALI. And I'm going to do a quick broad overview about OCALI in general. OCALI is an organization. We're based out of Ohio here. We don't really have boundaries to who can access us because a lot of our resources that we produce online can be accessible to anybody and applicable to anybody, whether they live in Ohio or not. A lot of our focus is around informing public policy, and I'm just kind of reading off that little our mission statement: informing public policy and developing and deploying best practices, linking research to real life, so that people with disabilities have the opportunity to live their best lives for their whole lives. So really, we look at a variety of centers that really focus in on empowering individuals with disabilities in different ways, whether it is through policy advocacy and trying to help influence that across the state for access to things, or looking at and identifying best practices for, whether it be in the school systems for educating and working within the school system with youth with disabilities or autism, to also the work that I'm going to talk more about today is working with multi-system youth and helping keep them more in home and empowering the local families and teams to support them differently in home. So as you can see, there is a variety of different centers at OCALI, and going to our website, I highly, highly, highly encourage you, if you have families that are working with kids with autism, have children with, sensory processing disorders or other disabilities, this is an amazing place to go to for intervention support, strategy support, and education around those topics through any one of our centers that maybe is focused. There is a really cool way to go to it, and I'm going to show you that real quick. Our family resource hub. So if you don't know where to go, but you know what information you're looking for, we started this family resource hub to make everything about topic, because even though we have each center in OCALI and there's a ton of information, there is crossover sometimes of some of these centers having multiple inputs of information, different things you can access. This way, it's organized by topic, so you don't have to remember, where did I find that info? If I need sensory supports, I can click on this and it tells me about where's all the autism treatment domains document that we have, the spectrum disorder basic document. Talks about all these things that we can start to explore through here, and it gets you straight to the website without remembering where did I go, bookmark it, those things. So just a little feature I like to highlight about our website. We also offer a statewide lending library that anybody in the state of Ohio can borrow books, equipment, sensory equipment. We have iPads and things like that for communication support, things that maybe a family or a team is wanting to explore or trial with the youth. You're able to borrow these through the OCALI Lending Library, which is on our website, free of charge, no cost to anybody involved, and borrow those items, books, and things until you're done using them, and then return them back, and the shipping is all paid for through OCALI. So just again, another great on-the-go resource for somebody that you don't have the budget, you still want to figure things out. Schools we find have a lot of benefit to that lending library, as well as provider-based programs. If they don't have a ton of money to invest in something, but they want to trial it first, it's a great place to start for them. Today, why I'm going to talk a little bit more after that overall spiel. I work in the multi-system navigation center, and the focus of this center at OCALI is very, very unique. As I said, OCALI focuses a lot on policy, direction, and advocacy, helping educate others and empower others. Our multi-system navigation center is one of the only centers that works directly with youth and families on implementation of strategies and supports in the family home. So there's two things I'm going to talk about today. One, I'm going to introduce the coaches and our MCAT project, which is the Multidisciplinary Comprehensive Assessment Team. Sounds really formal and important. But the way we look at it is this MCAT project, this is a partnership with the Department of Developmental Disabilities through Ohio, where we work with local county boards who have youth that are between the ages of 5 and 21 years old who are facing some challenges and struggles in their home with the parents' ability to support them effectively, whether it be related to, the past traumas, their developmental disabilities, the comorbid conditions that maybe exist with the intellectual and developmental disabilities that the youth may have. What we're finding is there are these youth that are engaged in multi-systems that are really challenging to support, and some of these families are considering residential placement, out-of-home placements for these kiddos, and a lot of it's due to not understanding some of their underlying characteristics or needs that exist due to the comorbid conditions of the IDD and the mental health disorders. So with this, we take on referrals from local county boards. Like a family may be working in with their local team and support systems, and they say, "Hey, we're struggling." The local county board service and support specialist can make a referral to the state department. That is accessible, the form here, so you can even learn more outside. If you go to our website, this MCAT Coaches Initiative information packet does do an overview of our referral there, as well as gives a little bit more detail about the process and the referral form. The criteria, though, I do like to say is that we only accept referrals from local county boards of developmental disabilities. The youth have to be affiliated with that department just due to our partnership and funding. We do not have any billing for services that we provide with this. This is all funded through that grant project with the State Department of Developmental Disabilities, which is why we have to have that eligibility requirement there. So once a youth is referred to us and we go through some information, they would sit the local team would present the youth's information, their history about their strengths, challenges, and kind of what brought them to needing this kind of case review. Um, our case review, our panel is made up of seven internationally known experts from psychiatry, psychology, autism expertise, trauma and resilience background, OT, PT, or OT and speech, education and transition future planning. So we have a wide scope of experts who have been in the field for years, and this has been their area of expertise. Listen to the challenges and what's come up, and dialogue with that local team after a collateral review to really hone in on what may be some of these underlying causes or driving forces that are causing the challenges and dysregulation that the family's experiencing. With that review, we then compile a recommendation, a report that talks about everything from those medical components all the way down to environmental components that might need to be considered or strategized around to supporting that youth and their needs differently in the home. With that, that report, it's only as good as the paper it's written on sometimes. And this is where I think the magic of our coaches come into play. Our coach, this is a really unique role, and it actually sounds kind of similar to some of what Courtney was discussing as well. Like with that need of application and the differences between how you would apply a typical intervention or strategy to somebody with just either a mental health disorder or just an intellectual developmental disability, definitely takes a unique approach of combining those two things to make it effective for a youth that has both multi-system, the mental health and intellectual disability. So our coaches are basically an extension of that recommendation list. We become a part of that local team with the family and help one understand what are these recommendations and how can we prioritize and approach implementation of these recommendations in home. And that could be anything from, visual schedules, four-part plans, looking at different priming things that we need to occur, even up to and including exploring different labs and medical follow-up testing that may be required to see if there's anything going on medically that could be causing some of this as well. With that, the local team, we help understand how can we support the family with taking on all of these, and then anything that goes to, let's say, visual schedules being identified as a support in the home was something that the family needed to start having success with. And our coach would come in and one, help the family members understand what is a visual schedule and why is it important to their kiddo. But then two, we're going to work on helping personalize it and model with that family how to access and utilize that visual schedule with their child. The goal is kind of like Courtney said, we're here to not do for you. We're here to empower you to do for yourself. So just like in a relay race, and I loved how you said it, Courtney, about handing off that torch. We're there to figure out what it looks like to create support in the home, and then hand that torch off to the family to be able to apply that support independently in the home. As we go through that, our coaches are organizing this information and completing. We call it we work from a model. It's called the ziggurat model. It's a behavior planning framework created by Ruth Aspey, that's focused around assisting individuals with autism on how autism may be showing up and impacting some of those day-to-day things that we may take for granted. So, that very concrete black and white thinking, there are some underlying characteristics we have to take into consideration when designing interventions. If we're not concrete and black and white with the intervention, we can't expect that it's going to be effective to it communicating to that youth. So it really is all about personalization and application in the home with that family at that point. Um, from there, our coaches, they will work alongside that family and team until there's a balance that the family says, we're feeling like we understand what's going on with this youth. We understand that when there's hiccups, how to respond or to look at that situation differently than we had in the past. And we've empowered that local team to help support the family in the same way with that understanding. So it is something that for each case and each family we work with, it's totally different. Timelines are going to be totally different. Some youth we've worked with for 3 to 6 months, and the family said we've got it, we're good. There have been some youth we've been working with for 3 to 4 years now, and we're still fine tuning some things with that family and application. The one nice thing I think, like I said before, with this being a grant funded project through the county boards, those timelines, prior auth, and payment type things, those aren't necessary for us. This is truly, we're here to have that flexibility to be there as needed and work ourselves out of a job ultimately. We do not want to be needed at the end of the day because we are temporary. So I think very much like Courtney's, it's an empowerment model. It's looking at systems that have been treated to treat things separately. How do we bring their mindsets together under this uniform umbrella and work differently together? And that's kind of our goal too. How do we influence that differently? So, if you know of youth or families that are maybe in that position of, we're thinking of the 6-year-old that, man, he's a handful. I wonder what he's going to be like when he's 16, when he grows and he's bigger and hits puberty. Is this going to be harder for us to handle? We'd rather work with that 6-year-old proactively. So when we're thinking of rumbling stages and what you're seeing as precursors that may lead to greater challenges down the line for that family, those are the kids that I think we could be the most effective with because you have a family that's listening, open and ready to deploy things because they have a little more confidence and they're not working from fear when it got to be too much and everything's in crisis. Because when you're in fear, we know this about the youth we work with as well as the adults. Our ears turn off, our minds close down, and we can't take in the new information to apply it differently. So proactive support and approach is our motto. So I encourage, if you see kiddos and families where you're like, this might not go the right way one day, those are the families to start talking to about these types of programs and resources. Because coaching, I think coaching models and this type of support, even with like Courtney's program, this is the proactive things that are going to prevent those bigger escalations down the line. So investing early and getting ahead while it's manageable. I can't say that enough times. I'll say it till I'm blue in the face. um, so from that project, we saw a number of, we'll say, foundational educational things that needed to be understood across the board for all multi-system youth. And we identified that not all providers, agencies, support programs, all the people working in the field aren't always aware of this. So what we did in a response was we created this program and series called the Navigation Essentials. And I have this website up on another page here. The Navigation Essentials, it started as a collaboration between the Department of Developmental Disabilities, OCALI, and the Department of Education and Workforce. Its goal was to help streamline some understanding between residential programs that were working with multi-system youth who maybe live outside of their home school district and engaging with the new school district of where they're residing because as a youth, they still have to go to school. This education program was started to help inform both parties of how to work together collaboratively, but then also how to understand the unique needs of some of these youth that might be coming to these local school districts due to the location of that residential program. So as a result, it then ended up creating these toolkits and educational toolkits where it's intended for direct support for professionals, ICF staff with the intermediate care facilities, school administrators, teachers, paraprofessionals. I have extended this beyond that though. This is for anybody working with multi-system youth. If you don't have that understanding of what these underlying driving forces could be, I highly recommend working through some of these family members to gain a good understanding and foundation of how different things may influence or show up in their child's life. These are things that you could use it for. The toolkits, they all have kind of like a step-by-step process you could take. You select a toolkit, and I'll show you them below. Within those toolkits, there's going to be some little shortcut tabs on the side that it gives an education piece with some videos. There's also downloadable resources you'll find based on the different topics to utilize as well. The goal is you utilize each toolkit to learn some background, understand a little bit about application, and then take it into your professional work world or family life and see how does this apply to my kiddo and those situations. So as you go through, there are ones like for here, trauma and resilience. You can see the different topics. So one, understanding ICFs. Two, the school partnership with the ICFs, but then it goes into more of the things that I think are universal for everybody that could be working with the youth. Considerations for intervention and supports. It looks at kind of like what we use that Ziggurat worksheet and Ziggurat framework model to understand. This is how you have to evaluate, assess, and understand the intricacies of the multi-system youth needs and how to balance them in a behavior support plan. Trauma and resilience talks about the different impacts that may be experienced through trauma and resilience and provides a lot of resources, strategies, and interventions to explore. Sensory with a focus on interoception talks about how, our connection to our body, feelings, and sensations, and how those play a role in our processing and our emoting and able to connect with others. So it really breaks down all of these different things that may have an impact on a youth and why they may be dysregulated. So when you get into these, You'll all each notice each one has a table of contents with three sections. They're each going to have a learn, a do, and a resources section. The nice thing about this is the learn is where you would click on the topic under the learn category, and this is where they're going to help you understand the topics of the focus. So, one, they're starting here with what is toxic stress. And then what is trauma and trauma memory? Each one has a different video. And again, these videos are not going to be 30, 40-minute long videos. We're talking 5 to 10 minute max clips that are giving you quality information and how it could be understood or applied in your situation. Um, we then also add in some different information and highlights that maybe come from the video. Um, you're then able to go through each of the different topics and go through, learn what you need to. There will be different visual supports that may be interactive and give you some explanation of what you're learning and looking at there. Um, but the do portion, when you get to the do portion, this is more your intervention strategies and resources that you would learn about and things that you could actually apply in the field or at home with your kiddos. Um, so for this, you would say, for example, we wanted to learn maybe about the four-part plan as a way to support trauma and the effects of trauma. You're going to get a video of it. It's going to talk about where it came from, why is it important, how does it help support. You're then going to go down and learn about the different parts of the four-part plan. So what are some types of activities? They'll give you some examples of what you could utilize for these activities. Then finally, it gives you these downloadable templates. These are tools that you can then take away and personalize your own four-part plan, you working with the youth and seeing here's the types of activities, let's organize our menu. Then on the next page, you'll see how to set it up with a 24-hour clock, things like that. So this tool set is truly here to at a glance give you some foundational understanding of some of the different things you'll need to apply when working with some of these youth with multi-system needs. And we've found that you can talk, you can leave paperwork, but you always have to have something to go back to. Those refreshers are needed, and this website being a central place that we could kind of indicate and point people towards when they needed this kind of education, it's been hugely supportive and flexible to them because it's not a commitment or a demand. It's available as needed, and they can come back to and revisit as many times as necessary. I'll stop sharing this now. So in a nutshell, I know I kind of flew through a whole bunch of stuff, but truly, I think it's we're taking a lot of this multi-system work and trying to focus on what are the differences, how can we bridge the gap between these systems with their understanding and how we apply supports and resources. And I think this is one way, a grassroots way of getting in there with the family and helping to attempt and trial that with the youth first and the family first to then show the systems how can we expand this? How can we expand this model to be a system response versus that grassroots response?
Come up for a
And
breath.
I think the most important part about that, Steve, is we don't have to reinvent the wheel. Because
Mhm.
as you were sharing that, I was like, okay, I'm going to share all this with my team because, and they, my team comes to me all the time, like, can we build this portal? And I'm like, okay, we could, but like this, it already exists. So let's
Mhm.
share it. Let's work through it together. Let's spread the wealth.
I
So
love it. And
thank
that's
you.
that's kind of our goal with OCALI is to let's bridge the gaps. Where there's going to be gaps at all times when you're working in the system of supporting people with disabilities. So our goal is to bridge those, be a partner to everybody and be accessible. So at the end of the day, if there are other things that like people see and they want to see more come out of these projects, we take that input from partners, from agencies across the state to really refine and reform. It's always a continuous quality review. So your input and feedback would be greatly beneficial. And the nice thing is there is surveys. If you see at the bottom of the one page underneath every table of contents, there's a link for a survey. We highly encourage utilizing that because it refines where we go from here. And we need that.
That's awesome. Yeah, these resources are so good and so user friendly. which is why I wanted you to be here, because I think again, just getting the information out there is the first step to providing these resources and putting them into place. One, I know that Amanda has a burning question, and so let's maybe we can address this because this is something that has come up with a lot of the families that probably we all serve. What are there resources for families to be trained in I guess managing aggressive behavior? And I've thought maybe my team at UC could do it. I've talked to Children's about their team running a training like this, and the answer is no, because we can't be liable, which I think is,
Yep.
a really difficult thing to address. Children's has said to me that they could probably be trained or certified in a way to extend the training to families, but they just don't have that yet. Um, in your work, Steve and Courtney, do you have any resources for families?
I I'll let you go ahead, Courtney, first
Yeah.
because you might have more direct connections.
Yeah. DDBP is always the first, and that can then expand into the adult side. But I would be totally open to a work group of some sorts to dig into that further. It looks like maybe Maureen, I don't know if you had something, you just showed up on my screen.
No, I just finally was able to show my face. Sorry.
Oh, okay. Okay.
So I
But
came up
yeah,
I came up the video to show myself.
yeah. So within our service model, we screen and we're unable to provide that physical management, but
Mhm.
I'm totally open to workforce or work group development for that.
I was going to say that is similar to your circumstance when it comes to our coaches. That is an area, a boundary we take because it is always focused around the proactive strategies and supports to avoid
Mhm.
getting to that. But I have worked with teams because obviously that has been a primary driver for many of the youth that we've worked with. And so
Mhm.
some families have gone through the CPI training and
Yeah.
other forms like UKRU and things like that that exist out there. It is finding funding for that. Sometimes
Right.
that is difficult. I hmm, I'm not at liberty to say things sometimes, but I will say that I do know the Keeping Families Together grants and funds have often been accessed for individual family training, especially when it's been need specific to some pretty extreme aggressive situations. And
Okay.
not always the best, but again, it is an option that maybe isn't always presented, but you can always ask about.
Okay, great. I didn't know that, so that's great to know. Yeah. Morgan is saying, I know there are programs that teach this, such as Handle with Care for safe and effective interventions for aggression. Not sure if there are any help with cost. They teach this. Okay, great. Thanks for sharing that resource. I'll include that in the Padlet. Which, by the way, I forgot to mention that at the beginning. We have a Padlet that we store all of the resources and information in the advocacy and action events. And I have a YouTube channel that I also share with the Padlet, but I did include that in the chat for you all. And I'll link the Padlet in there before we leave. A question I have for both of you is still like around eligibility, getting connected with your services. Can you give us a scenario, like this family X, Y, and Z, just I learn better, I think, with stories sometimes, and just like how does a family maybe in crisis go about accessing both of your services?
I mean, I can jump in real quick. We've had all spectrum. So I've had crisis where A youth is in residential placement getting ready to discharge home, and the family's panicking, and this local team gives us a referral to say, help us figure this out, and we really need the coach in to apply this support. Not the best way to apply our service because, again, that's more reactive. So we're working kind of uphill the whole time and we'll probably have different outcomes. But it is a way that we can get in. But it was through the state connection, working through
Okay.
that local county board and making that referral to the complex care support team, the complex
Okay.
needs support team through DODD. That group and the email address for that is on the information packet that I shared with you there. It's at the very bottom on how to connect and where to send them to. But that county board eligibility and being connected to an SSA is step one to then get the referral to the complex needs department. Um,
Okay, great.
Other referrals we've had that weren't so crisis oriented was I would say just a family, one of our younger kiddos, I think it was like a 5 or 6 year old, just thinking ahead that they're like, he's getting to be bigger. We're older grandparents, and we're curious that if he's going to get any more physical with us and start learning this power over thing works for me, we're scared of where that's going to take us. So we
Hmm.
came in to help proactively help that family. Their local team made the referral to the state. We got connected, and our work then just began following the session. I don't know if
Okay.
that kind of helps give a little black and white to it, but um,
Yeah, no, that does help. And I do love this idea of having a coach in the house. So DDBP does an awesome training on understanding behavior, and it's great. It gives you, the why behind the behavior, and they do give you a lot of interventions. But then I was
Mhm.
like, well, how do you implement them? And that this is a nice connection, because if there are families seeking interventions, but still they need the training as well to implement the interventions. I love that OCALI navigation systems navigation center, multi-system navigation center could be that coach. So, but the key is to be connected with the county board.
Correct,
Okay.
correct. And that's just due to that partnership that we have and our funding source to
Yeah,
make this go through.
that
Um,
makes sense.
and one nice thing too is sometimes we've worked with families both, you know, professionals in the field that we're in working with, as well as those that
Mhm.
maybe just have a high school education. So our we can cater and meet the needs of who we're working with, but then too, I always like to say this. There's always, we could say we've tried everything, but the one nice thing about the coach is sometimes it's the combination of things and how you tried and applied them that makes that unique difference and impacts the outcome. That's where our expertise comes in. So sometimes families are resistant because they're like, we've done all these things, and if you're going to give me these types of recommendations, like I've done it. And I always like to say, have we tried it this way? And have we
Hmm.
gone this way? So again, anybody across the spectrum and where a family's at, I think could benefit from it. Um, I know me personally, just even working with my own kid, I struggle with my own kid. I could be successful with a lot of kids
Hmm.
outside my own, but my own kid's always going to trial and challenge me. So even as
Hmm.
that professional, it is good sometimes to get that outside view because it's more of an ally. And that's what our coach is there for, to truly help coach you to do for yourself and be able to get through this successfully.
It's great.
Yes, that follow-up to that, "Oh, I've tried that." We haven't tried that together yet. Can we
Hmm.
try that together? So our biggest referral sources at transitions are Cincinnati Children's Hospital. There's a there's a police car driving by. So if you hear that siren, that's what that is. The DD boards across all the counties that we serve, this in the schools. So we do what we can to again be more proactive. We don't really look to meet people in crisis. We want to pour into the supports that exist that are designed for that, like MRSS in Ohio. We really want to meet people in a safe stable place, but we also know that that's a fantasy island vision that doesn't necessarily exist. So, but yeah, our biggest referral sources are that. So similar to what you described, when we get a referral from someone who's being discharged from, children's psych, um, we will, take that safety plan and implement that, and that'll be, kind of inform the way that we're going to approach. The work that's been done and things that have worked to stabilize, we want to try to generalize that. We want to try to rinse and repeat. We want to break it down and figure out ways, because I will share that we have, I don't even want to put a percentage to it, but there is a percentage of the people who we serve who their caregivers have their own IDD or have, experiencing, or they have IDD, or we have caregivers who are deaf, blind. I shared about our diverse languages, so we're always outside of the box, using those evidence-based tools that OCALI has. But how can we modify those and adapt them so that everyone around the table has a shared understanding of what it looks like to use those tools when the professional's not there to do it? So it takes tons of repeated practice. It takes we've worked with CABV. Say, can you help us with Braille? Could you, just all these different ways so that we can empower through a neurodiversity lens of the entire family. If we can't find a provider who speaks the language that's been referred, we're going to try through accommodations, through AI use, through our various methods, because we know our model can be replicated. So if the family is willing and able to participate, we've been able to be successful even with, without the native language speaker at the table to provide those services. So I just pride ourselves and my team on our ability to try and to navigate the due diligence. We are really looking to, some families have been jumping in a revolving door of services. We are looking to kind of slow that down. Not that there's never going to be another service, but what were some of the band-aids that have just been shoved on it and then just pushed out, that we can dig deep into what's the root that's happening here in the family system. So, yeah.
Thank you.
Mm-hmm.
Does anyone else have any questions before I ask another one? Okay, so Ohio Rise. I was trying to get somebody from Ohio Rise to be a presenter either this time or in June. But how Ohio, I'm sure you guys interact with Ohio Rise in bringing these different systems together. Can you share a little bit about that? And
I can share a lot about that.
okay,
We, when I sat down with the senators and state reps a few weeks ago, that was one of the main things that each of them asked me about.
okay,
Is what they wanted, my own opinion of Ohio Rise. And as a system of care, seeing that drawn out, I think it's a great idea of how we can build a sustainable model. And I could see us somehow replicating that to adults, because having a standard system of care with a standard measure and communicating in identifying levels of care would be great. But our biggest experience is implementing that on the behavioral side and the behavioral health respite side. And working a lot with the care coordinators. Are there any specific questions that you have about it?
just so when a person and it's Ohio Rises children, youth, right? Under 18 and under, or under,
20.
or 20 and under.
Mhm.
So when they are, so I guess can you share a little bit about what Ohio Rise is,
Mhm.
and what that care coordinator's role is in interacting with you all?
It's essentially a wraparound model of care that is the the care is determined into tier three and to three tiers. So you have your limited, your moderate, and your intensive. And those cares are levels of care are determined through the use of the child and adolescent needs and strengths tool, which is the CANS.
Mhm.
And once that CANS is administered, it has a an equation that happens that tells the family or the entire team what level of care they're assigned to, and then that level of care determines how often they're going to have contact with their care coordinator, and the care coordinator then makes referrals. They could be kind of comparable to like an SSA, I would
Okay.
say, or wraparound coordinator. Um, they're bringing that team together to drive action forward through the CANs. So the action planning is all determined through the CANs, through the needs have that are dangerous and disabling, for the strengths that have not been built yet. And so those referrals are meant to be made based on the needs identified within the CANs. And so they're referred to whatever, needs emerge from the completion of the CANs. Um, so, um, and then they also, care coordinators are working to get people access to any sort of residential treatment that may be identified. Through the CANs completion, they might identify that they need access to ICF, those intermediate care facilities. They might need access to QRTF or PRTF, that psychiatric residential treatment facilities. I think what I like the most about the CANs is the caregiver needs section. That really drives forward a lot of the action planning that we do as a team, because we'll really lean into that section. It talks about the caregiver's knowledge of the child's mental health and behavioral health needs, their organization, the safety, supervision, um, their own mental health and developmental needs. It talks about the family stress. Um, so it is an adult version as well, which is called the Adult Needs and Strengths Assessment, the ANSA,
Mhm.
that is comparable to the CANS. So it's a standard communometric tool that helps to drive decision making. So Ohio Rise has the ability to be something that we've kind of dreamt about in the
Mhm.
system. If you have teams who are working functionally and coming together, and participation is happening around the table. Like I said earlier, the idea of too many cooks in the kitchen, as long as we know what each of those cooks are doing, like, okay, this is your item, this is mine, and here's our shared vision, then we can really make progress. It's the gaps that still exist that I think get in the way of that
Okay.
progress. So,
Okay, that was helpful. Yeah, thanks for
mhm,
that. Do you have
mhm.
anything else to add, Steve? Like how you interact?
Yeah,
I
I
guess
mean,
they would be county referred if they
and
were.
it's very similar because there's different CMEs, different providers throughout the state that provide the Ohio Rise Care
Mhm.
Coordination Service. So based off of the organization supporting that, you sometimes have some differences in how they approach planning, how they approach coordination with other teams. So it is a big beast with a lot of newness that I think everybody's just trying to learn their place in the sandbox together. Like Courtney was saying, how do we bridge those gaps of understanding so it's not a competition and more of a
Mhm.
collaboration between services and understanding how we can both show up to support something versus it's you versus me. Um, I think that's been like the theme I've seen just throughout the state with the different CMEs, not just one versus the other. It's learning their role. How do we then apply it? And then one, developing that provider resource too, because of it being newer. That was something I think in the infancy stages of Ohio Rise, very limited in what providers were available to provide these different supports, such as respite or things like that. But now, since then, it's expanded a lot more and it's getting a lot better with connecting to those resources.
That
Um,
Yeah, our experience has been that some of the CMEs interpret rules differently, especially when it
Mm.
comes to respite. So whereas one is like, oh, this is what it looks like, the other is like, no, this is what it looks like. And so that has been interesting when you're working across counties, just having that different experience.
Mm.
But I hope one of the sustainable takeaways from RISE is that CAN's IT portal, having these electronic systems that everyone is able to access across providers and agencies and systems is super powerful. And I think that we could replicate that again into the adult side of services as well. To have one, it's the TCOM tool, which is ANSA and CANS, to have one, tool, communometric tool that determines levels of care. It is flawed, but everything's flawed, but it's speaking the same language. So, and that is really important when you're together, speaking the same language. Um, yeah, and some of the work that I kind of hinted at earlier, the behavior health attribution work that we've done, and I don't know if anyone else has heard about that, but that is through Children's and the Health Collaborative Behavior Health Attribution. We submit our client and patient panel on a weekly basis to a portal. And then that portal puts out notifications to let us know when any of our patients are hospitalized or
Mm.
accessing higher levels of care. And that's super helpful because when they are, we are unable to provide our service. So if we don't know and it's not communicated to us, then we've provided service and it gets kicked back. So that is super powerful. We get to know where they are in Ohio and Cleveland. They're at Cleveland Clinic. We get to know those things that previously we'd have to wait for the family to notify us, and it's the last thing they want to they're thinking of is, oh, I need to call my BHM out and for our home session next week. We get that notification, and that crosses children and adults. So this is where we're starting to expand those electronic health systems to close gaps in access to appropriate and quality and timely care. So that has been some of the work that we've been doing. It's really cool to have that access to that, and I would just advocate anyone that's interested in that work, reach out. I can share a little bit more with you about it. The return on investment, it takes a little bit because you have to build it, you have to keep contributing, but once it's built, then you have your own dashboard. You can see where they are, so, and why they're there. And
Yeah,
yeah,
that's amazing. I mean,
yeah,
it seems so simple, but
yes, but it's not,
the
because
impact is
everyone has
huge. Yeah.
Epic, CareLogic, all these other, EHR systems, but
Yeah.
having one centralized, even within Ohio Rise, they don't have centralized. They
Mm.
have
Hmm.
multiple record systems. So,
Hmm.
so yeah,
Wow. Yeah. That would make that would simplify things. Yeah.
yes.
Anyone else? And thanks, Maureen. Thanks for sharing your comments there. Anything else? Well, I really enjoyed this. I learned a lot. Thank you so much, Steve and Courtney. for taking the time to share with us. Everybody tune in next month, June 25th, and we're going to do it at 11:30. And I usually rotate the times, but we're going to stick with 11:30 in June because DDBP has a big event in the afternoon. And I know a lot of people will be attending that event, and we don't want you to be late for that event. So we're going to have June 25th at 11:30, part 2 of Navigating Behavioral Health Resources. And I will get this recording up on YouTube. One more time, here is the Padlet in the chat. And as always, please feel free to reach out if you have any questions at rac_Cincy@uc.edu, and I will put that in the chat as well. Hope everybody has a great day. Thanks.